Hello, my name is Amanda. This is my presentation on the topic of hospital-acquired pneumonia. This is just an overview of the topics. So, introduction, the definition of the hospital-acquired pneumonia, it's a lung infection and it occurs about 48 hours or more after a hospital admission. The importance is that it does lead to longer hospital stays, there are higher mortality rates, and increased healthcare costs. So it does account for about 15 to 20% of hospital infections. A significant portion of that is those on ventilators, so ventilator-associated pneumonia. Those two bacteria that are listed is what causes this type of infection. The nurse's role is to monitor, prevent, and quickly intervene. So my research question is, how can early detection and quick treatment help reduce hospital-acquired pneumonia in patients? For background, it goes into the overview, which is that it does affect, like I said, 15 to 20% of hospitalized patients, major portion being the ventilator-associated pneumonia. Complications, that includes antibiotic resistance, delayed diagnoses, and inappropriate treatment. The problem is that there's inconsistent prevention measures and delays in diagnostic testing. The focus of this project is to just improve detection, prevention, and treatment in the patients who are non-ventilated. So for early detection, we want to screen all high-risk patients within 24 hours of admission. For prevention measures, we want to increase care such as oral care, positioning, and mobilizing patients, and that should be 30% in 6 months. Proper treatment. So we want to ensure that 95% of patients suspected of this type of infection receive appropriate diagnostic testing within those 48 hours. To reduce those rates, we want to achieve 20% reduction in hospital-acquired pneumonia cases that in non-ventilated patients within 1 year. So the study design that I came up with, it's quasi-experimental. So we look into the pre and post interventions. For participants, it would be non-ventilated patients at risk for this infection. Intervention, so early screening, implementing the care, and ensuring that the microbiological testing, such as like sputum cultures, are timely, and that should be done within 48 hours. So the duration of this is going to be about 12 months total. So a month for staff training and setting up resources needed. Intervention should take 6 months and then 5 months to collect data. So for data collection and data points, that would be the incident rates before and after intervention. We want to adhere to those prevention care that were mentioned previously. Use of appropriate antibiotic treatment and diagnostic testing. And then for outcomes for the patients, it would look into the length of stay, complications, and mortality rates. So for analysis, we just have a descriptive statistic and comparative analysis to measure those changes. And obviously, we want to consider the ethics. So that would be to have a proper informed consent and make sure to follow confidentiality. So for outcomes, that would be to reduce those rates, shorten the stays in the hospital, and prevent complications and deaths. So we would have fewer amounts. For the nursing practice, that would be to improve adherence to those evidence-based guidelines, increase confidence in nurses to prevent and manage this infection, as well as just boosting job satisfaction. And so for cost reduction, lower healthcare costs due to reduced needs for antibiotics and shorter hospital stays. For more outcomes and implications, so roles of the nurse, just make sure to detect these issues early, prevent, and ensure appropriate treatment. So nurses should gain confidence in applying these evidence-based prevention measures. And then we just need to focus on consistent care, overall better teamwork, and improved communication to improve patient safety. In conclusion, these are my key interventions. So, like I said, the early screening, prevention bundles, which is the care, the oral care, and all that, and then enhancing the nursing practice. Um, Overall, we want to lower healthcare costs, improve patient safety, which should be number one, and then just have a more effective care delivery. For the action that's needed, it's to adopt those evidence-based practice um, frameworks in the management, and that can like significantly improve patient care and efficiency in healthcare. And thank you. That is it.